Hello, scholars. My name is Dr. Karis Dillon, and the goal of this channel is to make academic subjects easier to understand. If you haven't already done so, please click that subscribe button and like button so I can continue making videos. Now, in our last video, we covered agoraphobia, and in this video, we're going to be looking at generalized anxiety disorder. So let's begin. Generalized anxiety disorder is the most common anxiety disorder found given people. In order to be diagnosed with generalized anxiety disorder, a person has to have the following symptoms. A, the individual has to have worry and anxiety most days of the week for at least 6 months and at different places, whether it's work, school, home, etc. B, the individual has a hard time holding back their worries or their anxiety. C, the anxiety and worry that the person has to be at least 3 of the 6 symptoms that I'm about to describe, and that has to be within the time period of 6 months. 1, the individual feels on edge or restless. 2, the person can get fatigued quite easily. 3, the person's mind can go blank or can wander easily. 4, a feeling of irritability. 5, the muscles of the person's body feel tense. And 6, the individual will have trouble falling asleep, staying asleep, or their sleep will not feel restful. D, the worry or anxiety can be enough that it causes a distress that interferes with the person's relationships, school, work, or other social environments. E, the distress does not come about because of medications, drugs, or a medical condition. And then F, the distress as well as the worry or anxiety do not come about because of another mental illness. When a person has generalized anxiety disorder, the intensity and length of the worry is usually unrealistic compared to the chances of the negative incident actually happening. So whatever they're thinking about usually does not happen. It will be difficult for a person with generalized anxiety disorder to keep their attention on what they're supposed to be doing or trying to do because their fears and anxiety will creep into their mind continuously. Adults with this disorder will have an incessant fear about kind of everyday things like their health, their job, maybe their children at school or other family members, the performance of their job. Children with generalized anxiety disorder will worry about how they stack up to other children and their performance given different situations. The worries and fears that surface with generalized anxiety disorder tend to get in the way of psychological processing, so it can really affect your cognition or how you think. For a person without generalized anxiety disorder, they are usually able to put aside their worries when something important comes up and they need to focus their attention on it. And this really is not possible with somebody with generalized anxiety disorder. The fears, the worries that they have can be very distressing, tend to be very chronic. They last longer than most other people's worries and can occur at any point in a person's life. The more issues that the person worries about, the more likely they are to have generalized anxiety disorder. Now, when it comes to those that experience anxiety from this disorder within their body, they can have a host of symptoms. They can have everything from muscles that ache, muscles that may feel shaky or sore or twitch or even tremble. Others will experience other kind of issues like diarrhea, sweat that just seems to keep coming, or experience nausea. They may have a really quick startle reflex. They can also have a rapid heart rate, feel shortness of breath, or even dizziness. Within a year, 0.9% of adolescents and 2.9% of adults are diagnosed with generalized anxiety disorder. Females are twice as likely to experience the disorder as compared to males. And remember, females have a larger amygdala than do males, and that's the emotional center of the brain. It's nothing that makes them stronger or weaker. It's just something that is there. The disorder can peak in the 30s and 40s, and then as the individual gets older, that's when the symptoms of generalized anxiety disorder will begin to kind of lessen with age. Many people with generalized anxiety disorder state that they have felt anxious all their lives. The average age for this to come is about 30 years old. This is later than other anxiety disorders. The fears and worries will sometimes get worse at times and then seem to kind of recede for a while. So the chances of full remission are very, very rare without therapy or without some type of medication. And sometimes you'll even get people that try the therapy or they try the medication and they don't go into remission. It's something that's so strong. Those two things aren't effective for them. The earlier a child is diagnosed with generalized anxiety disorder, the more anxiety disorders they are likely to have within their life. Now, children can worry about, how they'll perform in a ball game, all the way to like worrying about school shooters and natural disasters or nuclear war. I mean, children, we never really kind of know what's going on in their heads unless they tell us what they're fearing. Children that tend to have these anxieties may be over-conforming, perfectionistic, and unsure of themselves. Those are just some qualities that tend to go along with that. They seek lots of reassurance and lots of approval. 1/3 of the risk of having generalized anxiety disorder is genetic. This disorder impacts a person's ability to do things efficiently and effectively at school, at work, or at home. The anxiety, fear, or worry takes quite a bit of time and attention from the individual. It is quite normal for persons with generalized anxiety disorder to have depression or substance use disorder. All right, well, that is the end of this video. I want you to know that if you are someone with generalized anxiety disorder, you are not alone. There are so many people out there that suffer from generalized anxiety disorder, and everybody's symptoms aren't necessarily the same. It isn't something that you have to keep closed or feel bad about within your body. If you do that, it is probably going to cause harm to your internal body. It's really good to talk with somebody. You don't have to go on medication, but medication has proven very substantial and helpful for people, especially when they're in that form of being triggered by something or they can't keep their mind from settling down. So it's really important to at least talk to a professional about some of that. It's not a sign of weakness. It's basically, when we evolved, and we survived through that evolution, our sympathetic nervous system, the ability, which gave us the ability to fight or flee, stayed with us. And we're not in a situation where we're in danger all the time. So this is why we have these anxiety disorders. It's nothing to feel bad about. So all right. Thank you so much for coming and using this channel. I'm hoping that it brings forth lots of good information, and I hope you share it with others. Thank you so much. I love my subscribers and the people that leave just phenomenal comments. You really make my day. So I want you to have a great day, and I will talk with you soon.